Thank you for settling so quickly. Good afternoon and welcome to the oath-taking ceremony for the Bachelor of Medicine and Surgery. A hearty welcome to you all, to the University of Pretoria executives, Dean of the Faculty of Health Sciences, Professor Tiaan de Jager, Deputy Dean Stakeholder Relations, Professor Flavia Senkubuge, Chair of the School of Medicine, Professor Soma Pillay, Head of Department, Nuclear Medicine, Professor Mike Setege, Professor Neil Maharaj, Vice Principal, Professor Vanessa Steenkamp, Deputy Dean Teaching and Learning, welcome. Welcome to the Faculty of Health Sciences, academics and professional staff. Welcome to the parents, grandparents, siblings, other family members, friends, significant others, and all who have supported and come to witness the oath-taking of the medical students this afternoon. Most importantly, welcome to the students who have worked very hard to be here this afternoon to affirm their commitment to the medical profession. What a privilege it is to have this auspicious occasion in person. As you sit here, remember the endless ward rounds, the late nights, the cemented friendships that supported you throughout this journey, the committed relationship to Red Bull. It is truly an achievement to be here this afternoon. With that, I would like to welcome the Dean of the Faculty of Health Sciences, Professor Tiaan de Jager, Professor of Environmental Health and the Director of the Institute for Sustainable Malaria Control. Prof. de Jager, we look forward to your message this afternoon.
Thank you, Program Director. Good afternoon, ladies and gentlemen. Members of the Senior Executive, Professor Sunil Maharaj, our DVC Research and Postgraduate Studies, that is actually attending as a proud parent this afternoon. Members of the Faculty Executive, HODs, Directors, and I need to mention Professor Martin Schwellnus, another proud parent, staff, parents and family, sponsors, graduates, ladies and gentlemen. Welcome to the Bachelors of Medicine and Surgery Declaration Ceremony of the class of 2022. A special word of welcome to all the family members and loved ones who have taken the time to join us this afternoon. I know some traveled long distances to be here with us. We welcome you all to the University of Pretoria. The Faculty of Health Sciences and University of Pretoria is honored to witness and to be involved in today's occasion. The first in-person declaration since 2019. To our students, today marks an important milestone in your life as you take the oath and declaration to commit to service and impact in health society. We bid farewell to 2022. And it is important to acknowledge the contribution, hard work, and commitment of our staff and the impact they had in realizing your goal and dream, and for equipping our students with the necessary skills to become #life changers. At the University of Pretoria, we are proud of doing things the UP way. We teach, learn, innovate, impact, and live the UP way. This means living and working as ethical, socially and environmentally conscious individuals who are focused on making a positive impact on society. So, graduandi, what you have learned while studying at UP puts you at the forefront of your discipline and at the frontiers of practice. Your skills are increasingly and critically needed in our own society and across the continent. Please make a difference. Ladies and gentlemen, I hope you will embrace this moment. Acknowledge those who traveled this journey with you. Celebrate with your loved ones, but do not forget the commitment you made towards changing and impacting society by improving the lives of many. A new journey awaits you, and enjoy writing your life's new chapter. Congratulations to you all on your success. To your family and friends and sponsors, thank you for your support that you have given our students on their quest to their degrees. Young doctors, some final words. Remember, you are in charge of your happiness. Smile. You don't own all the problems in the world. And remember, behind every fine doctor, there's always a nurse or a healthcare worker and a family member or some loved ones. I hope you will enjoy the festive season, and please be kind to yourself. Welcome and enjoy the event.
Thank you, Prof. De Jager. Thank you for reminding us that we all come from a community, and you all are here today because you were supported by someone, or definitely a large group of people. The next address is from Professor Mike Setege, Head of Department of Nuclear Medicine at Steve Biko Academic Hospital. He heads the Southern African Nuclear Medicine Research Infrastructure. Prof. Setege, welcome.
Program Director, thank you so kindly, and to the DVC, Prof. Maharaj, the Dean, Prof. De Jager, the Deputy Deans, Steenkamp and Sinkuru, and the Head of School, Priya. And then, of course, we have to welcome the previous acting Head of School, Prof. Kakaza as well, and to the heads of departments that are here. It's important that we really acknowledge you together with all the HODs that are here, but we have to also acknowledge and also say thanks to the executive of the school and the school manager, faculty manager, Dupree. It is important that we really speak about the important event that is here, and hence we also welcome the stakeholders such as Sama to be here and enjoy with us. This is a joyous moment, but before I really got into congratulating you, I have to say to the Vice Principal Research, as an engineer, you have to make a plan. It was painful to watch the Dean, because I realized you made this for me, but it was painful for the Dean. I mean, it was too long. We should make it to really be automated, depending on who's talking next. So the moment today is that of saying we want to congratulate the class of 2022, because we want to be proud of you, we are proud of you. This is a milestone in your learning journey, and indeed, your success is our success. It's the success of your parents that have supported you, as the Dean has said, but it's also the support of UP at large. We really are really impressed and happy for you. We really congratulate you for this. But as doctors, really, there is very little that one can say to you that you don't know. I mean, for you to reach this level, you must have had a lot of things. You yourself are mentoring and speaking to several people. So therefore, mine is to remind you of one or two events that you probably need to emphasize. Clearly, you know it all. But in that, therefore, my title is Perception and Attitude towards Medical Excellence, which I would hope and wish that that's what you must actually aim for. Your perception and your attitude towards medical excellence, you should actually strive for that. But whilst doing that, it's important to say that as we speak, normally we have to try sometimes to quote several good examples. When you quote examples, it's important, therefore, to quote examples that are relevant and that are applicable to Africans, South Africans, and so on. So what I'm saying is that as the doctors, as you aspire for your medical excellence, when you code papers, why can't you code a paper that is from Mokoena van Niekerk? Why should you first, that is assuming that all the papers of equal standards, of course. Why do we have this fashion of actually embracing other people and not actually first embracing ourselves? Because you are excellent, you have achieved a lot, and you are very well respected. But you actually neglect that. And I urge you that you do not do that to yourself. Acknowledge your fellow UP colleague, acknowledge your fellow South Africans in what they do. And that will be what will take us even much more better. But then the key message in that is that one has to use this code that of what use will your education be if you can't help your country in her hour of need. As you can see, our country is really in an hour of need. So your education should be the one that should be helping us. If your education is not linked to the entire continent of Africa, then it is meaningless. And that is important. And so says Onkopotsetiro. So I would like you, as you achieve that excellence, to actually remember that you must help us first. What it means is that why would you be focusing on other diseases when TB is actually, of course you must know other diseases, you must know them well, but if you cannot handle TB, which is common in our community, then that becomes meaningless to your education. If you can't be experts in cervical cancer, I mean, Professor Mapile here, I mean, if you can't do that, but you want to tackle other cancers, cervical cancer affecting our people, then that's clearly meaningless. If you can address the various treatment approaches in addressing aggressive prostate cancers in our community, that can be meaningful. And hence, you have to really go around doing that. That reminds me of coming to quote two of my mentors who are Professor Kies van der Meijden and Professor Ifai Mokoko, a top neurologist and a gynecologist. I mean, in so doing, it means you will get challenges. But Kies van der Meijden says, of course, we must make sure that we reconcile rather than confront. So you will be charged with confrontation, but remember to first think about reconciliation, be it with your colleagues or with the patients. Whilst Prof. Mokokon says that if it is too easy, then it is not worth it. So you must remember that nothing's going to be easy. You know it already, but if you think you're going to need an easy solution, like requiring a lift to success without going the stairs, you are in trouble. We do urge you not to be the typical BEE colleagues or frontings, shall we say, fronting colleagues that would actually not do what they are required to do, but they are fronting for others and not build and not create novelty or innovation, but actually act on behalf of others. And that is what we shouldn't do. And we saying that as class of UP22, we know you can do that better. It means then that one has to then at the stage remind you of your perception of saying that, colleagues, you must have a bee mentality. I mean, you all know what a bee does. It will go from one flower to the other. All it does is to take the nectar. It will take the nectar without destroying the flower. It will take the nectar, and it will take the nectar in the most dirtiest of the places. There will be a flower that is there. It won't say that that is dirty there, that is smelling. It will go for that flower and take that nectar and of course do the good with it. So it means in our relationship, we have to learn from that. It means you as doctors, you have to make sure that you focus on the positives, Because in your hospitals that you'll work with, there will be challenges, but you have to focus on the positive so that you can help your patient. Your goal is to help your patient. In dealing with that, clearly you will obviously see the good qualities. That will make your mindset, your mind to not actually have a terrible attitude as well. But if you are going to have a fly attitude, that's going to be the opposite. I mean, you will really get a burnout. You won't go that far. What it means, of course, is you know the fly, even if you can, you see the stage is clean, but you can have a fly flying around. The fly will always find its way of actually seeing the negative. It won't smell the sweet fragrance. You don't see the rose. It will see the dirt, and that's what is the problem. And that type of an attitude is really what can make you actually to be tired. So that represents the mindset of ignoring the good qualities around the people. Your nurses, some of them will be, yes, frustrated, somewhat on the laziness, same as the other colleague doctors. But try and see how you can actually motivate them by seeing the positive qualities in them, and that will take us far. So we know that you have academic excellence, and that academic excellence at UP is well grounded in the fundamentals of inspiring and having continuous improvement rather than perfection. I do urge you not to strive for perfection. There is still a lot of things that we should know. Ourselves here, we keep on learning every day. We learn all the time. Despite limited resources, try and see what you can learn out of it. Do not clench your fist, because you will really gain nothing, and you will also give nothing to your patient. So you can't be thinking that excellence is about complaining only without coming with solutions. Please do give the UP solutions to your patients and to where you are going, and that's what your teachers here have done in all the years to propel you to say that in a workplace, try and be innovative in what you can do and continue to learn, please. Please do come back to specialize. But when you specialize as well, try and also look at where else can you plug the gap. I mean, we can't all be gynecologists. I mean, so try and specialize. There's genetics, for instance. I mean, that has to come. There's other things that we must do that really requires new specialty that can be important. I mean, we really need your innovation to come there, and in that way, you will then embark on research. When we do research, one urges you to say that, please don't engage yourself in being a glorified data collectors. What I mean by that, we have to really be involved in the trials, clinical trials. But a lot of you will get a protocol that is from elsewhere. And when you get that protocol, all you do is to collect the data and give it to them. And you can't therefore call yourself a researcher by doing such things. Even if you do your own little study, but that you innovated yourself, that will amount to actually a meta-analysis of a big data elsewhere, and actually know how to drive a protocol, rather than going around saying you are actually a researcher, whilst you in fact are a marketing person. And one urges you, that is what I mean by saying actually don't go in front. That is also another way of fronting. And as a UP, we urge you to really do your own research and do it well. Do it with precision, even if it might be labeled small, but that will amount to big things to come. So you will again get negativity, and of course in the negativity there will be people that will see you worth 2 rents and perhaps see somebody worth a lot. But please do not focus on those people. Focus on those that will see you as worth 2 billion. Because if somebody wants to buy you at 2 rents and there's another one at 2 billion, it is important not to exhaust your energy to that other person. Really focus on the people that will take you forward, and that will actually be there. By so saying, I mean, you are the mentors, you're going to be the leaders, you are leaders already. And when you do that to your mentee, please remember that it's important not to destroy the characters of other people, be it your juniors and nurses. Focus on the positives, please. That will make a difference. It will be impactful, as the dean has said, and it will make sure that we propel ourselves even better. We want you to be the steward of medicine, the leaders of medicine. By so doing, as UP, for instance, it is about time we redefined what is a better public-private partnership. You probably seated here have lots of connections and lots of know-how, even if the colleagues here taught you. We are looking forward to making sure that instead of complaining that we don't have enough registrar places? How do we work in collaboration with the private hospitals? How does UP co-own a hospital that can help to train more of you? And that is the energy that you must use, and that is how you must help us. Yes, as your seniors, perhaps you might have not necessarily done that better and failed, but I mean, hence that's where it comes, the reverse mentorship. So as you go and work, you will see yourself as mentors, mentee, but mentorship goes both vertical and horizontal. So you must remember that we can get a lot from you, and I urge you to persist and look at solutions of how we can actually get more posts. At this stage, I would like to challenge you, as I've often done in other platforms, to say, please, can some of you come with evidence-based situation of why do we need to have 2 years of community, of internship and 1 year of community service. I'm a product of 1 year internship. And so are the others here. I'm still not convinced we need the 3 years. And then I'm urging you to say that, can you not come with the evidence that says, perhaps we can do it better? We can invest that resources in making you registrars and therefore plowing back in a better way. I really do not think that, I mean, you have, please take it in a good way that I'm saying, I mean, you are very, very smart, but why do we have to actually say you really need this 3 years? I really don't understand this. Remember that we wanted to do this when medicine was supposed to be 5 years, but now we've gone back to say medicine is 6 years. We don't want you to be grandparents by the time you finish, and you cannot do PhD. And that is the important thing. So as somebody perhaps that is from outside, it might be not enough to fight this. I believe this has to be corrected. I believe we can use your brains better if we actually redefine these 3 years that I'm speaking about. Perhaps we can take 1 year out, either 1 year of internship or 1 year of community service. And that is the leadership we are looking at that you should be getting. Colleagues will say, well, as you do it long, it's good, but there's no evidence for that. I think you can do better in your discipline that you like, actually. So I am saying that I encourage you to say you are good ambassadors of UP. As you go there, I encourage you to remember the complex of UP, Steve Biko Kalafong and other related hospitals, to say it has given you the success, therefore plow back to it. I do not want to engage more in it. I want to conclude by saying that what is important, as I have said, that the title for me, it's really a perception, an attitude towards medical excellence. For you to do that, you must have a non-polarizing attitude. Don't be polar. I mean, rigidity, it's a problem. You can't be fixed in a polar, north and south polar, east or west. It won't work, really. You have to realize that things are dynamic, and that will actually allow you to realize that there is diversity that you need to engage. Diversity in research, diversity in views, diversity in the colleagues that are there, and the religion. And that will make sure that as we do have that side, that diversity, we will be very inclusive. Be inclusive in your patient. Okay. Perhaps I am ending. You will be inclusive. You will have, as you do the diversity, you must have the belonging. Make sure that you have a sense of belonging. Do not forget that you have to redistribute what your power is. You are in a very powerful position. Please redistribute your power to the others. Remember that you will have you have the competence, the excellence, and the perseverance. But remember that that is nothing if you do not have the love, the care of bringing others with you. If you do not have caring and love, then that is futile. I am saying to you, congratulations, you have done well. Congratulations to your parents, but you are because of others, and you must continue to be because of others. Once again, congratulations. Thank you so kind.
Prof. Setege, we thank you for your wise words. We now welcome Professor Priyasoma Pillay, Head of Department of Obstetrics and Gynecology at Steve Biko Academic Hospital. Professor Pillay is a maternal and fetal medicine subspecialist with a special interest in high-risk obstetrics. Professor Pillay is a newly appointed chair of the School of Medicine. We welcome you, Prof. Pillay, to lead the students in the oath-taking statement.
Thank you, Program Director, Professor Maharaj, Professor De Jager, members of the school executive, heads of departments, students, and parents. Could I ask the students to please stand? And if you can follow me or say with me. On receiving my degree in medicine and surgery at the University of Pretoria, and on entering the medical profession, I declare solemnly that I will continue the ancient tradition of healthcare and service to humanity. I will respect human life. I will practice my profession diligently with dignity and professionalism. I will respect my colleagues and together will strive to maintain high professional standards. I will maintain and protect patient confidentiality and in all cases will conduct myself in an ethical and professional way towards my patients. I will continue the high standard of training received from my university through lifelong learning in order to remain a competent practitioner. Thank you. You may be seated.
We now request Prof. De Jager to join Professor Simapile to sign the statement. Thank you, Prof. De Jager. Thank you, Prof. Simapile. And now the students. The staff will direct the students to the stage, and Prof. Simapile will read out the name of the graduates and prize winners.
Afia Ahiopong with distinction. Saman Akhtar with distinction. Joshua Ashfield with distinction. Sefiso Vakela. Grace Baker, with distinction. Alexandra Beckerlin, with distinction. Leanne Behrens, with distinction. She's also the best final year student in family medicine during the GNK 691 urban rotation. Brendan Becker. Kathleen Best, with distinction. Samira Bayat, with distinction. Raymond Bosch, with distinction. Arne Both, with distinction. Darius Buerta. Barend Buerta. Jacobus Buerta, with distinction. Megan Bowden. Daria Boskaele. Siska Brink. Alicia Baseman. Imduduzi Tele. Luaya Claro. Kara Kutse, with distinction. Zenit Cohen. Bianca Costa Trey, with distinction. Ashton Crawford. Sally Hassan Crawford. Lei Kreiwagen. Dominique De Silva. Tasmia Darsut. Bilal Dawood. Alexandra De Freitas. Tim De Groot with distinction. Nicolette de Kock with distinction. Claudia de Kock with distinction. Conrad de Vries. Aluluto Disingo. Tulani Dladla. Caitlin Downes. Vicky Dubuisson with distinction. Emily Duplessis with distinction. She is also the student who obtained the highest mark for the clinical component of the final examination in pediatrics. Francois Duplessis. Rosanne Duplessis. Simone Duplessis. Sindisiwe Dube. Nonkululeko Diabu. Balungile Swinge with distinction. Barbara Emsley Botha. Sanchez. He also wins the Bongani Mayosi Foundation for excellence in leadership in the final year of medicine. He also wins the School of Medicine Prize to the student who made the largest contribution to the student community. Fatima Essop with distinction. Mangaliso Fakudze. Ayabulela Fezani. Brendan Fourie. Veronique Francis with distinction. Kyla Geldenes with distinction. Marnus Geldenes. Laika Good with distinction. Ineke Goede with distinction. She also wins the Horace Wells Medal from the South African Society of Anesthesiology, and this is awarded to the best final year student in anesthesiology. This prize is shared. She wins the Pediatrics Alumni Prize for the best achievement in pediatrics during the 5th and 6th year of study. She also wins the School of Medicine Prize for the best performance in the MBChB program. I'm not done. She wins the School of Medicine Prize for the highest mark in the final year, and the Frikkie Engels Prize for the best achievement as a student intern in urology. Taylor Gompel with distinction. Ruvasha Govender with distinction. Lara Greylen with distinction. Mark Greylen. Kayla Grobler. Michelle Harmse with distinction. Kaylin Harries with distinction. Rhoda Hartze Carla Hollembe with distinction. She is also the best final year student in district healthcare and family medicine during the GNK 688 rotation. She also wins the Nestle Prize for the best achievement in pediatrics at 6th year level. Grace Isiawo with distinction. Mohammed Ismail with distinction. Cara Jacobs. Jacques Janse van Rensburg. Mohammed Tariq Jusuf. Celine Jordan with distinction. Joshua Joubert. Sign first. Vernick Kachelhofer. Cherise Kanyane. Kanaye, sorry. Kanaye, sorry. Sintle Kosa. Lungile Kumalo with distinction. Christopher Knussen with distinction. Chapelwe Kungwane. Chapelwe Kungwane. Mika Landmann with distinction. Tony Latre with distinction. Elizabeth Leonard with distinction. Ivan Lowe with distinction. Vian Lawrence. Kamogelo Mabena. Tumisho Mabocha. Sinkobile Mambuza. Yanga Makozoma. Luvuyo Madikana. Mandisa Madikiza. Sinox Mahadu. Akshay Maharaj with distinction. Zakele Mashlela. Kamogelo Mashlobo with distinction. Tsepiso Maila. Jackson Maja. Joe Machachane. Onshia Metse Makakane. Shichimbiso Makamu with distinction. Relebochile Makabo. Mulanga Makwania. Moni Makwiting with distinction. Puti Makobela. Apelele Makwelo. Chantel Maluleke. Lesiba Mamabolo. Northern Mampiswana. Muletsi Managa. Mangope Manaleng. Zamashesha Manzini. Esther Mapanga. Connie Prudence Mashava. Gama Elimnandi Mashicho. Mashatle Masipa. Franco Mattia. Kietokwahe Maisela with distinction. Tanzile Imbonane. Anani Imboyi. Suk Mbu. Cherie Mukau. Chelsea Mills with distinction. Elliot Mntle. Sianda Manisi. Katlego Modise. Keletso Mofokeng. Tsekofatso Mogashoa. Julia Mokhwatane. Desiree Mohononi. Lebogang Mokoena. Palesa Mokoena. Moseo Molaba, sorry. Katlego Molepo. Ezra Moodley with distinction. Kalisha Moodley with distinction. Brendan Munsami. Abdul Musa with distinction. Lesejo Moramaga. Kefilwe Mosheshe. Tebatso Mosoma. Lebogang Motola. Solofelo Impatlele. Fatani Impapuli. Vuyiswa Ntsuki. Tovowani Mulovetsi, with distinction. She also wins the SAS of Gauteng North for excellence in obstetrics and gynecology. Welcome to our department. Vigneshwara Naika. Kolosa Indanadani. Impo Indlovu, with distinction. Akona Indisile. Luyanda Indlovu. Nontutuko Indlovu. Emmanuel Indo. Bongeka Ndwadwane. Carmen Neetling, with distinction. Natasha Nell. Gerard Nell. Joanne Nell, with distinction. Vutivi Nengovela. Chilitsi Nechipise. Inkululeko Ingobu. Nomfundo Inkopu. Senenshlala Ingubani. Nkobi Ngwenya. Tobias Niebuhr with distinction. Moleseng Ingatse with distinction. Litaletu Inkomonye. Nonsebo Inkosi. Fuyisiba Nompumza. Mohammed Nur Mohammed. Tololana Intai. Kaya Intlombe. Imtokozizi Intuli. Precious Ingwigwe. Rostam Ogweri. Mofeye Sope Olagoke. Tanya Oosthuizen. Ariel Osborne. Karina Pediaci with distinction. Elna Parekdava with distinction. Moaz Patel with distinction. He's also the best final year student in community obstetrics. Madeleine Pratt with distinction. Karina Pretorius with distinction. Christian Pretorius with distinction. Vion Pretorius. Tanya Prinsloo with distinction. She also wins the Department of Surgery Prize for the best student in the clinical component. Lucrecia Rabalaela. Maggie Ramela. Impo Rantla with distinction. Makatla Raseksoke. Munei Ravele. Kaylin Reddy. James Redfern with distinction. Adam Reich. Felisa Reinecker with distinction. Ashley Riley. Risunya Rivombo with distinction. Mishka Ruas with distinction. Jodine Rosen with distinction. Karine Rousseau with distinction. Yomari Rothman with distinction. Rivan Schmidt. Clarissa Skuman with distinction. Marianne Schwellness with distinction. Goaboana Sephora. Impo Sechala. Nicola Sergiant with distinction. Sanelisiwe Shabalala. Bomkazi Shishlala. Hajara Sikanda. Nompilo Sitole. Nchembo Sitole. Horai Siziva with distinction. Sumandri Smith with distinction. Timothy Snyders. Marinee Snyman. Fikile Sombili. Insika Sombili with distinction. Joanne Spies with distinction. Annemie Steyn. Tertia Steyn with distinction. Chris Stadrum with distinction. Benito Swart. Brittany Swart with distinction. Venko Taljard. Primo Tau. Lerato Tema with distinction. Keyuren Tave with distinction. Aromatron with distinction. Nolwazi Tuzi with distinction. Aldona Tommy. Kaylee Trump with distinction. Yonela Tuswa. Kirsty Lee van der Haar. Corneille van der Merwe. Hendrik van der Merwe, with distinction. Petrus van der Merwe, with distinction. Petrus van der Merwe, with distinction. Verne van der Merwe. Carly van der Mesht, with distinction. Janet van der Walt, with distinction. Carla van Lille, with distinction. She also receives the LJ de Groen Medal for the best achievement in obstetrics and gynecology. Celia van Niekerk, with distinction. Janée van Tonde, with distinction. Okkert Vermeulen. Natasha Victor, with distinction. She also wins the Horace Wells Medal from the SA Society of Anesthesiology to the best final year student in anesthesiology. This prize is shared. Shanae Falyoun, with distinction. Christelle Falyoun, with distinction. Danique Visser, with distinction. Adrian Vlok. Marissa Volmaltitz. Lumka Vumba. Sai Sangwang. Yalenke Weber, with distinction. Sander Wessels. Andries Visser, with distinction. Natalie Woodhouse, with distinction. Luke Worrell. Luandiso Jacobi. Nomathemba Zikalala. Lisa Zilwa. Lusanda Zongo.
Thank you so much to all the executive. Thank you so much, Professor Mopile, for ushering the students so kindly. Next, I would like to welcome the two student representatives, Dr. Dean Entris and Dr. Yowan Now. The two class representatives will be giving the word of thanks. I'm sure it's not a shock to all of you how well Dean is loved. So before they give the word of thanks, we'd just like to award Dean with the Summer Award. Please come up.
Six years, 72 months, 2,192 days, 52,608 hours, 3,156,480 minutes, 189,388,800 seconds later, we are doctors. 17, we walked in our first year classroom as entirely different people. Through these 6 years, we have learned more about ourselves than in all our lives before that. We have grown in ways in which we cannot explain. 400 years BC, the Hippocratic Oath first saw the light. Today, as many doctors before us, we took this oath. Today, we move forward as practicing doctors who will do no harm, who will do good, and who will change the world, one patient at a time. Class of 2022, fellow colleagues, I am proud of you. We have walked a road with most of you, and I'm so proud of how each and every one of you have grown. You are all going to be such amazing doctors, and I cannot wait to see what each of you are going to achieve going forward. So now I say, wherever you guys are going next year, I want you guys to go well. Hamba gachle, sepela gabotse, laat het goed gaan.
Good afternoon, university staff, organization members, colleagues, and our friends and family we are lucky enough to have with us online as well as in person. I would like to start by thanking the South African Medical Association and the Bongani Mayosi Foundation for their contributions. And I want to thank my class for deciding that I should be the one to receive these awards. I go on then to wish to express then my deepest gratitude to our UP staff members that have passionately and sympathetically, in their professional and personal capacity, supported and guided us on this journey. I wish to extend this gratitude to my class. Truly, it is the teamwork that makes the dream work. Yes. Finally, I want to acknowledge our friends and family for the foundation they helped lay long before we started this journey, and for their continued support during this degree. Class of 2022, there are 3 thoughts I wish to leave with you. Do not delay your life. Medicine is challenging and always with many nexts. There will never be a right time. Obtaining this degree sadly does not change how our brains work. We must continue to relearn that which we will inevitably forget, keep up to date with the ever-changing medical landscape, and broaden our horizons as doctors and otherwise. Finally, especially in the context of our resource-limited, disorganized healthcare system, the first person at the start of each day whose health we are vowed to optimize to the best of our ability is ourselves. Class of 22, again, I wish to say that this is an impressive milestone, and I'm immensely proud of each and every one of us. Congratulations, class of 22.
Thank you very much, class representatives. We now invite Professor Flavia Sekubuche, Deputy Dean, Health Stakeholder Relations in the Faculty of Health Sciences. Professor Sekubuche is a specialist in public health medicine, is the head of the Behavior and Health Management Science Division. Professor Sekubuche, we welcome you to give the acknowledgments.
Maya Angelou, in her beautiful poem, Still I Rise, ended it off by saying, I rise, I rise, I rise. So please rise. Let me be the first to say, fellow doctors, please, the first round of applause is to these amazing people who've supported you through your journey. Please give a round of applause to your families. the second round of applause, doctors, is to you. Is that all? Come on. Thank you very much. Please be seated. I do want to say, as you sit down, and I want to reiterate what Prof. Sateghe said, medicine is a very long journey, and you may not hear this again, but I do want to say it categorically. Please take care of yourselves. Take care of your physical and mental well-being. Never, ever be ashamed to take a rest. Please rest when you need it. And know that you are worthy, you matter, and your voice counts. This is an African university. We're proud of our African heritage. And in Africa, when we send off our children, we usually give them a blessing. And so please allow me, on behalf of the elders, to give you a blessing. May you rise and rise and rise. May your hands always be anointed for good. May harm never, ever come to you. May you always be protected. May you find favor wherever you go, in whatever you do. And so with this, I really want to acknowledge you and congratulate you on your hard work. And I really also want to thank our wonderful and amazing Dean, Prof. Diaga. Please give him a round of applause. And I don't want to leave out our Deputy Dean, Teaching and Learning, Professor Vanessa Steenkamp, who's really a mother to all of you. So please also give her a round of applause. I also want to thank our school chair, Prof. Soma Pillay, and I also want to acknowledge Prof. Mandisa Kakaza, who was also a school chair and has just been pleased. Prof. Sateghe, who I call but Mike, thank you so much for accepting our invitation and inspiring our students and reminding us, you are because of others. And so I really want to also thank the faculty advisors who are here with us today. And I know, Professor Maharaj, that you're here as a parent, but I'll be in deep trouble with protocol if I don't thank you. And I also want to thank these events, colleagues, they don't happen just on their own. I want to thank all the people who had a hand in organizing this for our students, Mrs. Judy Hassett from the Office of the School Chair of Medicine, the Marketing and Communications Department, especially Mariana Cotta, and all of the colleagues from Student Admin who I saw walking around. And I really also want to lastly say what a wonderful, wonderful program director we've had this afternoon. Dr. Yvette Hlophe, thank you so much. And last but not least, I want to thank all the sponsors for their generous contribution throughout the year. Dr. Hlophe.
Prof. Sekabuche, thank you for that beautiful blessing you bestowed upon the students. We have come to the end of the declaration ceremony. However, before you head back to your ward rounds, we would like to celebrate this memorable day with you. A gathering without food is simply a meeting. And therefore, to make this a celebration, refreshments have been prepared. So we'd like to invite the parents to also please come down and join us for refreshments. But before you come down, we'd like you all to stand for the national anthem.